right, let's talk about something that us breast surgeons do that sounds like magic. Finding your hidden breast cancer. Yes, we routinely remove things that you or me literally cannot see or feel. And how on earth do we do this? Spoiler alert, it involves wires, magnets, and a lot of teamwork. Basically, it's like surgery meets science fiction or magic. Imagine being told that there is a tiny change on your mammogram. It's smaller than a pea, but you can't feel anything, you can't see anything. And this is what often happens these days on a breast screening mammograms. And this is what we call non-palpable lesion, which means we cannot feel it. We doctors always talk in this fancy language, and I think it's just to make us feel more important. A bit like lawyers. I never know what they talk about. What not palpable means is that you or me cannot find it or feel it with our hands, but it's there, we promise. So when it's time for surgery, my job is to play high stakes hide and seek. The prize is microscopic and the stakes are your peace of mind. Before all the gadgets and gizmos, we had old school technique, which is called wire localization. And it's pretty much exactly what it sounds. On the day of your operation, a breast radiologist, which is the X-ray doctor, puts a very thin wire, less than a millimeter, into your breast or into your cancer, pointing right to the invisible spot. Then it's my turn. I follow the wire where the target is hiding. It's a bit like you putting the address into Google Maps or Apple Maps and then driving to that address. It works beautifully until you realize you are now walking towards the operating room with what suspiciously looks like a tiny antenna sticking out of you. And let's say it's not anyone's favorite pre-surgery photo op, but it pretty much never fails. We have moved on to a smarter, easier, sleeker technology. Think of it as Apple meets oncology. In the beginning, they used to use radioactive seeds. These are not commonly used in New Zealand. Rollers was used in Waikato. I'm not really sure whether or not it's used there at the moment, but it sounds pretty dramatic, right? It's a teeny weeny, we're talking about like 5 millimeters or less, seed that emits a trace of radiation. And we use a probe to find it, like a surgeon with a Geiger counter, those beep, 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 beep machines that you watch in a spy movies or if you watch Chernobyl. Magnetic seeds are non-radioactive version of the radiation one. And it basically follows a magnetic beep like metal detecting. It's like those things at the beach that they go and find metal. It's used in Gisborne in New Zealand. I don't know if anyone else in New Zealand uses this. RFID and radar tags, Savvy Scout. It's the same kind of technology used in your car key or a dog or cat microchip. But now it's helping us remove these tiny little cancers that are not being able to be felt. It's starting to use in the Wellington Public Hospital. We're trying to get funding from insurance companies like Southern Cross to be able to do this. At the moment, they're playing a hard ball because it's more expensive than a wire, and they don't like to be paying for more. These are tiny little things that we remove at your surgery. So it's not going to stay in your body forever. It means no wires, no antennas, just a sleek futuristic system that makes us feel like Tesla of surgery. Here is the fun part. After we remove this small area of the tissue, so we aim around a centimeter 360 degrees all around your tiny little cancer. And we send that tissue with either the wire or one of these seeds. We x-ray it either in operating theater or we send it to x-ray department. Sometimes we can feel when we've removed it, but we can't actually necessarily see it. Or if it's a precancer or DCIS, we definitely cannot see it on the naked eye or feel it with our fingers. So why do we do this? Because we want to make sure we got the exact bit with the marker and the margin. That little clip or a spot must be in the x-ray of the specimen. Otherwise, we have to go back and take more. It's like you've put a takeaway order and we double check that everything you ordered is inside, not something that's wrong that you haven't ordered. Often patients ask me before the surgery, will I feel this marker? My answer is always, nope. It's so small that even an airport security scanner wouldn't notice it. The other question that's often asked is it painful? And the answer is not really. The localization feels similar to biopsy. Actually, most of my patients say it's easier than the original core biopsy because with the core biopsy, it's a bigger needle that goes into a tissue, while the wire species is very little. We do this similar to the core biopsy under local anesthetic. And to be honest, X-ray doctor or radiologist does the hard bit. I just follow the breadcrumbs and make sure that the results look neat and looks like the other breast, or is closer to what this breast that I'm working on looked like. So yes, surgeons really do find invisible lumps using magnets, many antennas, and a healthy dose of teamwork. The secret is in advanced imaging, precision tools, and occasionally a sense of humor. If this demystified the process of the breast surgery a little bit and made you smile, give it a thumbs up, subscribe, and share it with someone who is curious about what happens behind the door. And most importantly, thank you very much for watching this video. Bye for now.